name is Michelle Bravo. My topic about is complication chlamidia. Definition. Chlamydia is a common sexually transmitted disease. It is the cause of the bacterial chlamydia traumatic. It affecting the both in the men and women. Women get chlamydia in the cervix, rectum, in the throat. Men can get chlamydia in the urethra, in the inside the penis, the rectum, and the throat. You can get chlamydia during oral, vaginal, anal sex. In the white somas, in the walls in the infection. In the womb, also in the post chlamydia, in the baby during in the children.
What is it, and how does it spread?
Well, chlamydia is, as we explained earlier, is also a sexually transmitted disease. Is caused by Chlamydia trachomatis, and it's so common and so persistent because it's a silent disease. You could have it forever and don't know you have it. And the most likely is sometimes you get a clear discharge, vaginal discharge, but that so many it's so common for women to have discharges that they don't even notice that they have this. So nowadays the recommendation is that anyone gets, before the age 24, gets a screen for a chlamydia infection. And it's very simple to be screened for a chlamydia infection. You could do it in urine, you could do it through a cervical swab. Why is this so important? Because the chlamydia is something that you pass from one partner to the next, especially in people who have multiple sexual partners. And chlamydia, even though it does not cause any particular severe infection, it causes a lot of issues with infertility later on in life. It affects the fallopian tubes and could predispose to ectopic pregnancy and other complications that are associated with it.
Yeah, I wanted to get to that too because you mentioned infertility, but there's a number of complications here with chlamydia I don't think people would immediately think about.
Right, exactly. Especially because it's such a silent disease, it's going to cause pelvic inflammatory diseases and inflammation of the pelvic cavity. Infertility because it affects the fallopian tubes. The fallopian tubes have a cilia, which is what allows the motility of that sperm to travel and the egg to travel and meet the sperm. And when that cilia gets affected somehow, it predisposes to ectopic pregnancy. What happens with ectopic pregnancy? Well, ectopic pregnancies are those pregnancies that occur outside the uterus that could rupture and has an increased risk of maternal mortality. As well as pregnancy complications, chlamydia infection could predispose to preterm labors, and newborn complications. Well, babies are born, they use antibiotic on the eyes, and the reason is to prevent chlamydia infections.
Ken.
Application in nursing. Nursing covering the patients and the chlamydia and the while the balls and the information. The patient will in the problem the why the necessary information about the scope and the evolution disease. The necessary preventing the hygienic and the gilding in the window also mark in the well in the day the avoid in the infection in the future in the addiction in the monitor the patients in vital and control the administration of the prescribed medication.
Think that you might have chlamydia? Or have you recently received this diagnosis? Stay tuned as we will be talking about the 5 most common symptoms both men and women with chlamydia experience. Welcome to JHP Medical. I'm Dr. Hart Pinto. I'm going to tell you the 5 most common symptoms of chlamydia and a few important tips. If you like this video, remember to subscribe and click the notification bell so you don't miss out on any of our most up-to-date videos. So what is chlamydia? Chlamydia is one of the most common sexually transmitted infections in the UK. Chlamydia trachomatis is the bacteria that causes chlamydia and spreads through unprotected vaginal, oral or anal sex. If left untreated, it can cause serious problems for both men and women. Amongst men, the infection can spread to the testicles, causing pain and swelling. For women, the infection can progress to pelvic inflammatory disease. This can lead to persistent abdominal pain and long-term fertility issues, meaning that you may have difficulty getting pregnant Fortunately, these complications can be avoided where infections are identified and treated early. Symptoms of chlamydia normally develop within a few weeks of unprotected sexual intercourse. The top 5 symptoms of chlamydia experienced by women are pain when passing urine, unusual vaginal discharge, pain during sex, bleeding between periods or after sex, pain in the lower abdomen or pelvis.
Pros and cons. Chlamydia infection is the common is the STD that can infect in the body in the man and woman. Cause a serious and permanent damage on woman's reproductive system and they make it more difficult or impossible in the become pregnant in the future. Chlamydia infection in the can also lead to ectopic pregnancy in the core you see the uterus that be fatal.
Chlamydia, what are the symptoms? Could I potentially have it? How is it diagnosed? These are the questions that we answer at My Health Spot. Common STDs and about 4 million cases in the US are diagnosed per year. Most actually are without symptoms, known as being asymptomatic, but still infectious. If somebody feels just fine, looks fine, and doesn't seem to have any problems, they can still acquire the infection through intercourse. And the other key point is actually ejaculation is not required to spread the infection. So, what are the symptoms of chlamydia? Symptoms, when they do occur, can be confused with vaginitis, which is going to be change in vaginal discharge, intermenstrual vaginal bleeding, as well as bleeding after sex. When you go to the doctor, the physical exam is rather unremarkable, and actually you might look completely normal. Incubation period can be around 7 to 14 days, but it's actually unclear if you are asymptomatic when you acquire the infection to begin with. It can be up to months to even years since you had the infection. The second thing besides cervicitis can be what's called urethritis. The urethra is the last part of the urinary tract system as it exits your body and can develop symptoms very similar to urinary tract infections, which is going to be dysuria and pyuria, meaning dysuria with pain with urination, as well as pyuria, which is going to be pus in the urine itself. About 25% develop urethritis and can be confused with a urinary tract infection. The difference and the key point is on the testing. On urinalysis, which is a very typical test done for urinary tract infections, you'll find what's called pyuria, also known as white blood cells, in the urine without evidence of bacteria, and the urine culture will actually be normal as well. Now, cervicitis progresses to pelvic inflammatory disease. This means that the chlamydia has actually spread to the actual pelvic organs themselves, including the uterus, the fallopian tubes, and maybe even further. The rate is about 2 to 4%, but likely the incidence is underestimated because in PID, with chlamydia specifically, that the symptoms can still be asymptomatic and only found later when somebody goes to the doctor because of infertility. The exam findings when you go to the doctor might have what's called cervical motion tenderness, meaning that when the uterus is moved, there's pain, as well as pain around where the ovaries typically are found.
Issue replied in Ecuador. Women between in the 55 and the 24 have the hereditary in the STD in the woman general population in the disease cause present, ascending in the infection and complication. In Ecuador, prevalence initially in the gonorrhea and chlamydia traumatic in the age group, since in the most causing infection. The gonorrhea and C in the traumatic and the asymptomatic is a necessary implant and the mer and affecting in the chlamydia detection in the pathology.
Chlamydia is a sexually transmissible infection, or STI, that is passed between partners during unprotected vaginal, anal, and oral sex. Many people with chlamydia do not have any symptoms, so they may not even know they have it. It is the most common bacterial STI worldwide, especially among people aged 15 to 29 years. Chlamydia commonly infects the urethra, but can also occur in the throat, anus, and even the eyes. As the body's immune system fights the STI, dead cells from the immune system and cells that die as a result of the infection are occasionally passed out of the body as a clear or milky discharge or pus. Other symptoms can be stinging pain or burning when urinating, or swollen and painful testes. If left untreated, chlamydia can continue further into the reproductive system, affecting the seminal vesicles, vas deferens, epididymis, and the testicles. Because the vas deferens and the seminal vesicles are so small, any scarring as a result of the infection can contribute to reduced sperm counts and infertility. Untreated chlamydia can also cause chronic epididymitis, which is persistent inflammation and pain in the testes that can be difficult to treat. Chlamydia and other STIs can be prevented by using condoms and water-based lubricant during sex, having regular sexual health checkups, and ensuring you or your health provider notify your sexual partners if you are diagnosed with an STI.
Conclusion. Starting from the both debates in the social and economic impact of the chlamydia infection in the world and our country, we will able to systemize the most innumerable aspects of the term, the types infection, the cause, the characteristic and diagnostic term in general, and measure about the team. Our result, negative impact in the society is important in the protect the barriers on the having the sex in this condition.
Welcome back, friends. In this video lecture, we'll be talking about sexually transmitted diseases. And this group of disease is known as STDs. Okay, so this is not one single disease. There are agents, and we'll also conclude about why this disease happened, how to figure out and identify the disease, and what are the treatments and prevention cures for the disease. So let me take a color first. Here you see a statistical diagram of rate of the STD in UK between 2003 and 2012. So see, between 2003 and 2012, in these 10 years of window, you will find the cases of STD rising, and it's rising since then even. It's kind of linear if you check it. So it's kind of increasing. And
Thank you.